I'd like to go over a little case report of one of my patients, which is interesting, as he reported to my office. He's a 43-year-old male with horrible brain fog, anxiety, poor digestion. As a child, was on Ritalin, anti-anxiety medicine, always dealing with weight issues, poor self-esteem, and just never feeling well. There was a history of an appendicitis in his history, and during that procedure, possibly may have even had been resuscitated during the procedure, but he cannot validate that for sure. But anytime I hear something like that and they're pumping oxygen into you in an emergency situation, all these little hits take a toll on the mineral system. So on his first hair test, we see on 8/6/19, he's in a 3-low pattern, which is very similar to a 4-low, which is, pretty severe burnout, adrenal burnout, the thyroid's burnt out, nothing is really working too well. We also have a sodium-potassium inversion, where his sodium-potassium ratio is 0.60. And so we have part of it is a potassium loss. Part of it is he is in chronic infections, chronic, just chronicity, whether it's the metals, the infections, the poor health. Overall, it's always a low level of health when we see that. So as we go through a hair tissue mineral balancing program, on his next test, we wanted to see that inversion improve. That was one of my first goals. And as we moved forward, we went to 12/6/19. So we went from August to December. And in that period, we see that the sodium-potassium inversion went from 0.60 to 0.83. And so not too much of a change, but it's heading in the right direction. The patient has been compliant with doing everything that I have told him to do, including the coffee enemas, daily, saunas, frequent, and all the other homework, and taking the pills and a lot of digestive support. Then we fast forward to his third hair tissue test, and we see that brings us to April 30th, 2020, and we see that his sodium potassium went from 0.83 to 2.86. That was fantastic. His sodium went from 5 to 20. His potassium went from 6 to 7. The ratio is beautiful. He's starting to get some adrenal reserves. His zinc is picked up in this picture. So when the zinc picks up, that's going to start driving the zinc enzymes to make stomach acid, to make digestive enzymes, to help with DNA synthesis, to help with the transcription of DNA to RNA, to help stimulate the white blood cells, especially the macrophages. When zinc stimulates the macrophage, then we have aggressive macrophages that can do their job and really protect you, protect your immune system. It's turning on your immune system. And so when we see this great, picking up of energy, when the sodium potassium go up and the calcium magnesium ratio holding strong, we know that he is about to start to dump metals. So on the next test, I'm going to suspect a dump of metals. And we will report back to you on the fourth hair test in about 3-4 months. So that's just a quick check-in, seeing how we're making progress with this patient who's been struggling his entire life with poor health, brain fog, anxiety, and all the things I listed earlier. So just wanted to give you a quick update on serial hair tissue analysis and when I think we're about to start to dump some metals, as I see that sodium potassium rising, and we will see a metal dump next hair tissue analysis.